So my name is Dr. Jeff Yu, and I am a dual board-certified pediatric and adult dermatologist here at VCU Health. So in general, my areas of clinical interest include atopic dermatitis and allergic contact dermatitis, and these are various types of rashes that oftentimes end up creating what we call eczema. So I will see adults and kids who have these very common conditions. So I fully believe in letting the patient lead and advise in terms of how they want to approach their patient care. I think nowadays we are at this incredible juncture in dermatology where we have so many different treatment options, and not all treatment options are appropriate for every patient. And I do believe that at the end of the day, it is the patient that should make the decision on how he or she wants to initiate treatment. All the options will be laid out on the table, all of them will be available to you. I will certainly let you know what my preference would be, but I think at the end of the day, what you prefer is by far the most important. I've always enjoyed the type of patients that we see in dermatology. I feel like the patients we see in dermatology in general are there because of a concern that they can visibly see. And then the way that I am able to diagnose those conditions can either be done through direct visual inspection. I can do things like perform a skin biopsy, so we're able to provide you with some sort of a treatment plan and or reassurance that this lesion that you're worried about is something that's benign. So I think what's incredible about the academic atmosphere here at VCU is that we are a very collaborative team-based approach. You also have other areas of healthcare, whether it is cardiology, whether it is ear, nose, and throat doctors, whether it is orthopedics, whether it's internal medicine or pediatrics. I think we all work together as a team. That's the nice thing about having all of your care under one roof, is that we're able to have these open conversations and frank discussions with one another. I think what I like the most is the patient interaction. So usually in a typical day, we may see somewhere between 20 or 30 patients throughout the entire day. I love meeting all of these patients. A lot of them may be familiar faces, therefore I really get to have that kind of longitudinal care where I get to find out more about you, who you are as a person, your family, what you did over the summer, what you look forward to doing. And I think having those short conversations during the visit really kind of brings that patient provider relationship kind of to a deeper level. Not only am I there to find out and learn more about you, of course I am also there to help you with whatever you were coming in for in the dermatology aspect of things. But I do think that, for me at least, is one of the very enjoyable parts of doing what I do.